Now, with these 4 chambers of the heart, they have gate, and that gate is interestingly one-way gate. So we call it as a valve, heart valve. So we have 4 one-way valves. So this is a major outflow tract into the heart and openings between the atria and ventricles. And they have names. I want you to understand their names. So for that, I want to show the actual valve system here. So from the right atrium, entering into right ventricle, there's a big valve, which is called tricuspid valve. So you look at the shape, it's like a sharp shape. This we call cusp. Or you look at this, a sharp teeth. The names are tricuspid because it has 1, 2, 3 lobes. And then this right ventricle, you send out deoxygenated blood through to the lung. That's called pulmonary valve, which is in here. And then after this, the oxygenation through the lungs, and then it gets into the pulmonary vein to enter into left atrium. So the left atrium to the left ventricle, there's a big valve, which is, you can see there's a 2 cusps, so we call it bicuspid, or people call it as a mitral valve. And that mitral comes from Latin belt or turban shape. And then the blood inside the left ventricle, now you are pushing this blood through the systemic circulation, through this, that gets into the aorta. So the name of this valve is aortic valve, as you can imagine. So what happens if there's a problem in this valve system? Here I put an example here. So aortic valve, when there's a pathologic process going on, that this valve gets narrowed down by fusing and thickening of this valve. So here is an example of aortic stenosis due to rheumatic heart disease. Then this aorta, it may not be able to push through this valve. So in that case, this patient may need an artificial heart valve, which I already showed you before. So then artificial heart valve is now pretty good, long lasting. The problem of this artificial valve can cause turbulence after this valve. And what's the problem of turbulence in flow, blood flow? Turbulence can cause a stagnation point within this system, which means the blood doesn't move very much. So when the blood stops flowing, it can cause a blood clot. So the clot, which by chance can form here, that shed through this aorta and that gets into the brain, you can get ischemic stroke. So this is why that's a very, artificial valve has also an issue by itself. It increases the risk of stroke.